Yeah, thank you, Chair. Minister, first of all, I appreciate you coming before us. I know when the invitation was issued 14 days ago, it was to do with the increased restrictions in the Kildare, Laois and Offaly area. And I think over the last 14 days, while it's disappointing that Kildare hasn't emerged, I think we have successfully managed the outbreak in those counties. And by allowing the public health experts to take the lead, we have dealt with the virus as best as we could. I think, Minister, over the course of today, I've taken two things away. One, when I hear Paul Reid talk about us living with the virus, and I hear Dr. Ronan Glynn talking about how we can reopen sensibly, we are essentially engaging in a strategy now, not of a zero-risk strategy, but actually the idea that we must allow our economy reopen so that we can go to school, so that we can engage in our health service, and so that we can protect our jobs. But we must do so with the balance always being on the side of public health. If that is the case, I think your analogy of risk management, which there was some discussion about, is actually the correct one. An analogy I had used many times, and I risk using an analogy again, is the idea of the first time you let your child walk to the shop. You never know when it's the right time to do it. It inevitably involves risk, but you know you need to let that child grow and gain independence. So each time we go out into the world, there is risks, and as we head into a world of living with the virus, that is what we are doing. However, Minister, what we heard today was the idea that while previously activities were judged on whether it was possible to have social distancing and the public health advice, we now seem to be moving into a different area where some activities, even though they are possible to have social distancing, they're not permitted because it involves increased household contact. And can I say, Minister, that I think brings us into a difficult territory where we're making judgments about what is a good activity or a bad activity. It's always a dangerous area for government to be involved in. And if we're going to have this for long periods of time, living with this virus, perhaps we are better guiding people to have a prescribed number of social contacts or a prescribed level of social contact, and to allow them to apply it, whether they want to go to a football match where they can stand 2 metres apart from people, or whether they want to go for a meal in a restaurant where they're only 1 metre. Different people choose different things to do in their life, and I worry that if we're going to stay with this for long periods of time, we may be in a difficulty where the state is dictating what is a desirable activity. I know that's not the intention at the moment, it's as we unravel, but if this is going to be with us for several months, I think we need to give more leniency, and we need to get back to a situation where activities, where people can more easily understand what is permitted and what is not.
Thank you very much, Deputy, for that. Can I just say on the issue around comparisons of risk, that during a conversation about getting the schools open, I did make a comment about our need to manage risk. And one of the examples that I used, I believe, did cause a lot of genuine hurt and anxiety and concern. It was in my head, as it happens, because that's how one of my kids broke their arm recently enough. That's why it was in my head, and I wasn't for a moment suggesting that the risks were comparable at all. But I understand that in an environment where people are really very worried, that people were, it did cause anxiety, and I certainly didn't mean to add to anybody's anxiety on that. Can I provide some good news to the point you make on children, Deputy, which is this: the Royal College of Physicians of Ireland have just released their latest view on the impact of COVID-19 from a health perspective on children. And I'm just going to read you one paragraph, if I may. A quote as follows: "It's clear now that, fortunately, the vast majority of children who get SARS-CoV-2 infection do not develop severe COVID-19 illness. This also appears to be the case for children with underlying health problems. These children may get an infection with very few symptoms at all, or they may experience an illness like, but usually no worse than, the seasonal flu. children who are immunocompromised or taking immune medications for inflammatory conditions, such as arthritis or inflammatory bowel disease, also do not appear to have an increased risk from COVID-19. So we're all worried. I'm sending my own children back to school tomorrow. But there is good positive news emerging from the experts on this. To your broader question, Deputy, in terms of, I guess, what's the right balance that we strike in managing the risk in our society? And we are all figuring this out, as every country is as we go. So, as was put to me by medical experts on Kildare, Laois and Offaly, because of early detection, because of what we now know about the virus, we were able to bring in much less restrictive measures than the countrywide lockdown that we saw. The point was made to me by one expert that had that happened 4 months ago, that would have actually spread into the whole country, and we would have had to lock down the whole country. So I think if the first piece of good news is that the medical evidence on children is very reassuring. I think the second piece of good news is we are learning every day about this virus, and we're now at a point where, as proven by the efforts of Laois, Kildare and Offaly and the people living there, targeted localised measures can work. And I guess you're now asking the next question, which is, can we be even more non-specific than that? And actually, maybe we all at this point have internalised, we all know the guidelines, you know, limit our social interactions, wear the face coverings, obey social distancing, and all the other measures that we all now know. I think the answer is hopefully in time, yes. And if Chapter 1 was flatten the curve by locking down the country, we're now at the start of Chapter 2, which is suppress the virus in a targeted way so the rest of society and the economy can function. Maybe what you're describing is Chapter 3, that it will become so implicit in how we live and work and interact that will be enough. The expert view from NEFIT is that we are not there at this point, and that right now, based on the increasing number of cases in Ireland, the rate at which they're rising, and the profile of those, that they are in workplaces, they're in homes, they're in social settings, that right now we are very finely balanced in terms of a second wave. And if there is a second wave, the government will have to consider the very blunt instrument which we know works, which is a lockdown. So we're doing everything we can to avoid that. Certainly, the public health advice right now is that targeted measures are needed. And I agree with the spirit of what you're saying, Deputy. We've got to trust people. People know how to deal with this. In some of the targeted measures, we are specifically targeting areas where maybe the level of compliance isn't what it needs to be, and maybe simply just trusting everybody to do the right thing isn't enough. So, for example, we know that there are a number of house parties, and we know that they have been considerable vectors of this disease.
Thank you, Minister.
I
might ask.
Wallace wants to use a minute and a half. There is no more than that, I'm afraid.
Thank you, Minister.